So when you're monitoring anesthesia, the things that are important to look at when you're monitoring, first is heart rate. You want to make sure it's not too high or too low. If the heart rate is too low, the body is not getting the proper circulation, it's not being oxygenated properly. And if it's too high, they can be oversaturated. And you monitor the heart rate. You always have to take manual readings, and then you also have the monitoring equipment, the ECG, that helps you monitor the heart rate. Heart rhythm is also important because there can be arrhythmias that weren't noticed before, and so the ECG also helps you monitor that, and you want to make sure that the heart is functioning properly throughout the procedure. Mucous membrane color is important because if it's pale or blue, that means they're not getting enough oxygen, so that's really important to watch for. If you see that it is pale or blue, check respirations manually. Obviously, check to make sure that there's, you should have already checked all this beforehand, but make sure there's oxygen, make sure everything is hooked up properly, make sure nothing is blocked, and then proceed from there. Making any changes, turning off the ISO and giving just pure oxygen. You can give size of oxygen. Capillary refill time is important because it tells you about tissue perfusion. It shouldn't take longer than 2 seconds for the capillaries to refill. So that also relates to how much blood the body is getting and how circulation is working. Pulse and blood pressure. You want to make sure that the pulses are strong, that the heart is functioning properly and getting blood to the body as it should be. And blood pressure, same thing. If the blood pressure is too low, the body's not getting the blood and the oxygen that it needs. And so having them on fluids during surgery helps with the blood pressure. The respiratory rate is important because the body needs oxygen. So if they're not breathing enough, the respiratory rate is too low, they're not getting enough oxygen, they're not getting proper anesthesia either. If the breaths are too shallow, too quick, same thing, they're not going to get enough oxygen. So you can sigh them, and if the respiratory rate is too high or too low, they need to be getting full breaths at a constant rate in order to be properly oxygenated. Respiratory rhythm can tell you a lot about their depth as well. If they're taking really slow breaths, that means that they're pretty deep under anesthesia. If they're overdosing, they can have jerky respirations. If they're breathing too fast, it could mean that they're too light, so it's an indication that you need to check on the patient and their anesthetic depth. Body temperature is important because if the body temperature drops too low, organs can start to shut down, their body's not going to be processing the anesthesia correctly, it's going to prolong recovery, so it's really important to use things to keep the animal warm. They should never be on metal. They should always be on a blanket or a towel, and you can use heating devices like bear hugger, warm water heating pad, warm water bottles. Just never have a heating device directly contact the skin. And the monitoring devices are here to help you. They don't replace you taking manual readings, but they just help you in between. Never trust a reading. If there's a reading that seems not right, if it says they're not breathing and you look and they're breathing, don't trust what the machine says. Always monitor yourself, but they're just here to help. So the reflexes are important because they show you a lot about the anesthetic depth. The first reflexes to go are the swallowing reflex and the palpebral reflex, and the last one to go is the corneal reflex. So the ear flick, if you pinch the ear, it should flick. The pedal withdrawal reflex is if you pinch or pull on like their finger or like the skin in between the digits, they should withdraw. The palpebral or wink reflex is when you kind of tap on the inner canthus, and it should cause them to wink, like kind of flinch. And the corneal reflex is when you actually touch the cornea, there should be some sort of reaction. The body should react in some way. The swallow reflex you use when you're recovering for the most part. You want to wait until they swallow on their own before you extubate. Jaw tone you use the most when you're intubating. You want to see how much tension you feel when you try to pull the jaw open. Eye position starts centrally, As they go under anesthesia, the eyes go medial ventral, and then as it progresses, if the eyes come back to center, then they're overdosing on anesthesia. So it goes from under anesthesia central, and then not enough anesthesia, and then it can also mean overdose. So you have to consider what's happening, consider all of your other vital signs to see which that means. And the respiratory pattern, as I mentioned before, they can get jerky respirations if they're overdosing. If they're very deep under anesthesia, they'll have slow respiration, so that also tells you a lot about their anesthetic depth. And you just want to make sure that you're taking everything into consideration. You're never looking at just one number or one thing. You're putting together the whole picture, and that's why putting everything together is important for anesthesia, because everything works together to tell you. So our patient charts are just check-in reports, and so we have the patient's information on here, and then we write notes, and then we input everything into the computer at the end of the day. And this is the monitoring log. So you have all of the drugs, the patient information, and the time, and you monitor every 5 minutes. Heart rate, temperature, respiratory rate, mucous membrane color, and capillary refill time. Blood pressure, SpO2 level, CO2 level. We use ISO, so the ISO concentration, oxygen flow rate, and any kind of heating we use. We have a heated table, but we also put towels down and put water heating pads in the cages after. And so you monitor the EKG, and this is an example of what the EKG shows. It shows the heart rhythm, any arrhythmias. And so here are the EKG probes, and we have our blood pressure with the cuff, and SpO2 monitor.
Hopefully we can at least clear some of that infection with the antibiotic.
Okay, so I'm using a 40 blade, and I'm shaving for a space. I'm going to shave from the xiphoid process all the way down and all the way to the sides.
It'll be 126, and then if you do decide to do the dental, just schedule it on the day that I'm working. Okay? Oh yes, yeah, I will. Well, I'm a little bit suspicious that the sneezing might be being caused by dental dysfunction. You know, like if she caught her deep claw while she's rubbing her teeth with her mouth, then it might be related and we might not know it. So we're at least triaging the infection. And then we can decide, you know, if we want better, you know, we can keep more compressor and keep it comfortable. You know, so she's ready to go now if we're not going to do the dental, but I would say probably within the next couple weeks I would, because otherwise it might just take time. Yeah, it looks like it needs to come out based on it. You'll see it when you take her home if you're able to just lift her up. You don't have to like open her mouth. A lot of what I do to stay safe with the lake animals is to lift her up and you can look at that canine. So look at the lower left canine. You'll see what I mean. It's uncomfortable and there's gingivitis. It doesn't, you know, it looks easy. And it's kind of on the same side as you. Okay, and then you got the deacon upstairs, so she's ready to go. You can put that in. Okay, around maybe noon or 1. 2 o'clock. Okay, she wanted to know how long she was in. Thank you. Okay, you're welcome. Yes. And then let's just put the delicate one. Find it with our I hate how she says she's looking at the phone. Do you notice how stable it is in the syringe?
Why do you know that it's Snyder?
means let's have this start.
The lady said she didn't.
So start with chlorhex, and you start from the middle, and you work your way out, and you never go over the same spot twice. And once you get to the outer edge,
Alright.
you
Yeah,
toss
that
it,
looks like a dental.
and you alcohol, same thing.
So why don't we go ahead and do that?
Can you just get rid of this?
I am or so.
Another chlorhex. Alcohol.
Did you bring that squeaky stroke?
Yep.
The dental?
Yep.
Where is it? Not there.
No? It's right here. Okay,
Silly